Hello, and welcome to a wonderful interview with another one of the Savvy Seniors Living wonderful sponsors that we have, which is LivHOME. I'm Dayna Wilson, Seniors Real Estate Specialist with Keller Williams Realty, and today I am chatting with Dale Martin with LivHOMe. Hi, Dale.
Hey, Dana, how you doing? Thank you so much for having me.
Air hug. Oh, this is so hard. This is so hard to not be able to, see people live and hug them and have coffee meetings and what have you, or see you at the seminars. But I want to make sure that we check in with our sponsors and see what is the new normal for you guys. So I guess personally, how are you doing?
Personally, going a little stir crazy. Both my wife and I work from home. She gets 90% of the house. I get the gym area and office space.
Nice.
So
nice.
It's challenging, but we're getting through it.
Oh, awesome. Well, you look great. You look healthy and happy. So.
Oh, well, thank you. You look great too.
Oh, I don't know about that. Yeah.
I don't really get dressed for the day. I still have sweatpants on, flip-flops.
Our viewers don't need to know.
Oh, okay, I won't say that.
Too much information. Hey, I just want to know what's going on with LivHOME. How are you helping people during the shelter in place? And I guess it's a twofold. Like, what are you doing that's different now? Why don't we start on that? What's different about the way you are serving your clients these days? And maybe tell people what LivHOME does, first of all, and what you do.
So we're a professionally led geriatric care management company and caregiving services. So we offer two different types of services, geriatric care managers and caregiving services. So what's different now with the model? Well, a lot's changed. So every shift before someone works, we have to ask them a series of questions and they have to respond to us. We do that through text message bots. And if they respond that they do have a fever or that they have a family member that's been experiencing symptoms of COVID-19, we reach back out to them. So that's something that's changed just on sort of an accountability piece with our caregivers. Every intake that we get for a new client now goes through the same sort of questions that we ask. And we typically are doing more things virtually. We do assessments with our new clients virtually. We typically do a caregiver introduction face-to-face. We do assessments in the home face-to-face. Now what we're doing is encouraging that from a remote status. Some other things that we're doing differently is we're really trying to help our clients they're more isolated than normal to try to find things that bring them a lot of value and try to bring those pleasures back into their life. If they usually would go out and go for walks in the park and they're not able to do that, we're trying to do things in the yard. So they may be doing gardening or cooking or just walking around the neighborhood, staying closer to home. And we maybe do the shopping for our caregivers, for our clients. We still try to do the same things we've always done. It's just in a different way at the moment.
Aw, you guys are awesome. So you're doing things a little differently. And so the caregivers are still going to the home. What can you do for folks that typically, like you just mentioned, going grocery shopping, and what are you doing that, again, more like things that are different that COVID has stopped you from doing?
Well, what are we doing different that's COVID related? So we can't go into hospitals anymore. We can't go into skilled nursing. We aren't going into assisted living anymore either. Mm-hmm. So a lot of our clients, we're no longer providing services, and we're helping them figure out ways to get their community to provide the services that we were providing. So, that's a little bit different. So if there's a lot of clients that we were working with that are community-based, or skilled nursing or hospital based, that service line, at least for the moment, has gone away. The way that they define essential workers for non-medical caregivers is pretty subjective to where that client lives. So if they live in assisted living, we're considered non-medical caregivers, and we'll have to engage the community more. But that kind of defines, there's a line drawn in the sand about essential workers and non-essential workers. So a lot of things that you may think that might be considered essential and this time isn't. So a lot of things we're doing in the home that we'd typically take someone out to get their hair done or their nails done, we're actually helping them get those things done in the home.
Oh, come to my house. I need all that. Oh my gosh. Yeah. Oh. So what about some silver linings? I mean, do you have any happy stories to share about any of your clients, or, good things that either have come out of this or you see might come out of this?
I would say the two silver lining things that have really helped us is really force the technology component that I don't think will go away. The Zoom meetings that we're doing with our clients and caregivers in the home, I think those will continue because we'll reach out to people in the home that way, and it's forced our human resource department to do all of our onboarding through different portals. So we've never done that before. So every process that we've done in the past that was sort of labor intensive, paperwork intensive, has gone to sort of a remote model where everything's gone electronic. Our service agreements are signed electronically. Our HR paperwork's done electronically. So I think that'll be here to stay, and we'll be connecting more with people and probably being able to reach more people by using the technology component that we have. And actually, we're hiring more caregivers now because a lot of home care companies are actually down in business. So that's been a good thing for our recruiting side.
That's awesome. Well, hey, that is
yeah.
definitely a silver lining. And I think with things like these Zoom interviews like we're doing today, especially it can be the new normal for meeting with maybe a potential client's family members that don't even live here, right?
Absolutely. And we're doing that a lot.
Ah, that's awesome. Well, oh gosh, is there who might reach out to you right now that maybe normally wouldn't? I mean, have you gotten any calls from people that, they need a little extra care? They've never really had in-home care before? Because of the situation we're in, we're getting a lot more calls from people that may be out of state concerned about their loved ones. And our geriatric care managers, I like to think of them as like a surrogate son and daughter. So if there's someone that maybe isn't able to see a doctor, or typically the family members are able to follow up with them, right now there's a sort of a disconnect. So we've been able to really help with bridge the gap between sons and daughters that live out of state and clients that actually live here locally. I think that's awesome. Yeah, Well, we're also at the Dayna Wilson Real Estate team are doing everything virtually, and we are essential as well, but that still has some very specifics as far as the protocols we have to follow, and all the new forms we have now. We have all these COVID forms from the California Association of Realtors that now are added to our contracts and such. But gosh, is there any last minute comments that you'd like to share with folks that you want to make sure they know about LivHOME? You mentioned care managers. How many do you have, and are you taking on new clients? Anything?
Well, we are taking on new clients, and we have two policies around our caregiving services. We do take COVID-19 clients. We're the only non-medical home care company in the Bay Area that I know of is actually putting together protocols and processes to actually take care of people that are symptomatic with COVID-19, or if they think that they have COVID-19, we're still doing what we can to provide care for those individuals. And we're taking care of families that are in this situation that don't have someone here that can advocate for their loved ones. So we're still here. We're still working daily, providing care to many people in the community. So if they don't know what to do about a situation, our geriatric care managers are a great resource, and they're specialists in understanding what senior resources are available. So if they just don't know what to do with their mom or dad, or they have questions, have them give us a call, and we'd help to navigate through the healthcare system for them.
That is awesome. What's the best way for someone to get a hold of you guys?
I would just say, just give us a call at our main number, and we can help you out. It's 925-296-0406.
Awesome. And what's the best website?
Our best website is www.livhome.com, and it's LivHOME, LIVHOME.com.
Nice.
And we have a bunch of information on there about our geriatric care model and how we horizontally integrate that with caregivers if needed. And it talks about what we're doing differently in the COVID-19 environment.
Awesome. Well, keep on keeping on. Keep up the good work. Keep on supporting our sweet seniors and their family members. You guys do a great job. And as we were talking before we started this meeting officially, my visit with you a couple months ago was just really eye-opening. I'm so impressed with all you guys do. And the care that you give, and the knowledge and the education and what have you. So, and I'll leave with thanking you again for your support and your sponsorship with the Savvy Seniors Living seminars, and hopefully we can get back to them soon, but hoping to get those on Zoom as well. So until we speak or meet again, air hug to you, and thank you for your time, and hopefully we'll see you in person soon.
Absolutely. Thank you so much for the opportunity. It's great seeing you.
Thanks. Bye, Dale. Take care.
All right, you too. Thank you.
Bye.